is the 77 WABC minicast.
Sunday morning. Live long and prosper. We all want to live longer. And, well, we have Dr. Peter Michalos with us and giving us advice on how to do so. Dr. Peter, give us some thoughts today.
Well, John, today we're going to talk about a very important topic, and that is heart health for longevity. And our heart is our fuel pump that takes us for the entire ride. And our heart basically starts to beat at 3 weeks after conception, and it shows up on ultrasound usually around 6 to 7 weeks, where we have a rhythmic beating of the heart. And our heart, on an average, beats 100,000 times a day. So you can imagine how hard it has to work, and it basically has to circulate all the nutrition, the blood, the oxygen, the food, the energy that keeps us alive, and it keeps us healthy. And that's why it's important that we take care of our heart. And as we get older, we have to be much more conscious of it, and there are things that we need to do. And one of the important things as far as annually, when we hit age 40, we should do an electrocardiogram. An electrocardiogram basically analyzes the electrical impulses of the heart, and if there is ischemia or restricted blood flow in the heart, it shows up on the EKG. And especially if we have risk factors like hypertension, diabetes, or family history of heart disease, it's important to get that checked. The other thing is we have now amazing blood tests where we can check, and the guidelines are to check your cholesterol and your LDL. L stands for, I call it the lousy cholesterol, and HDL is the happy cholesterol. That's the mnemonic to remember it. And you want to keep your LDL below 100. You want to keep your HDL 40 and above. And another very important factor that they're starting to measure more now, they use it in Europe a lot, is the apolipoprotein B, which is the carrier of cholesterol. And they've shown if you can keep that consistently below 100, below 80, even better, your risk of heart attack and stroke dramatically decreases. And what can we do to protect our heart? And of course, it all starts with the fuel we put in and eating a heart-healthy diet, as you and I always talk about, focusing on fresh fruits, vegetables, whole grains, beans, lentils, nuts, seeds, fatty fish like salmon, and also things like sardines or wild-caught sardines are excellent, lean proteins, and also limiting your processed food. If it comes in a bag or a box, you got to be careful because a lot of excess sodium is added sugars, and things like trans fats. And we want to avoid the seed oils because they're not heart healthy. We want to focus on the olive oil, the avocado oil,
so
and even some coconut
bottom
oil.
line is you have to watch what you're eating. Otherwise, you're going to create a problem for your body. And all you are is is our creator. We created a chemical machine, and you got to keep the machine going. And it has to be all the right fuel that goes into the machine.
Yeah, absolutely. And along with that, you also have to treat the machine well. That's why avoiding tobacco and nicotine. We know don't smoke or vape, and even secondhand smoke when possible, because that cuts up to 10 years off your life, and it increases the risk of blindness from macular degeneration 3 to 4-fold, which is pretty wild how smoke gets to the eye. And it also increases the risk of lung cancer. And we also know that our heart needs to rest, and our kidney needs to rest, and our gut needs to rest. And that's why at least 7 hours of sleep a night is very important. It's restorative. It supports good blood pressure, metabolism, mood, and overall cardiovascular
It's a
health.
combination of food in. It's a combination of intermittent fasting, maybe, and a combination of getting all the right minerals and I guess the right water supply and don't use chemicals that our creator did not create. In other words, don't put saccharin in your coffee. Don't put all those chemicals in your coffee.
Yeah, absolutely, because that also disrupts the gut microbiome, and it disrupts the good bacteria. and they found that the gut microbiome is 80% of our immunity. And in heart plaques and heart attacks, they found bacteria from the gut, some of the bad bacteria. One of them is called proteobacteria, and the other one's for Mercedes. And when they analyze these heart plaques, like when they do heart stent surgery to open up, they take some of those plaques and they've analyzed them, and they found bad bacteria from the gut. And that's why all we discussed is so important, because there's 805 There's 805 heart attacks every year in the United States. That's a heart attack happens in the U.S. every 40 seconds. And we need to also limit alcohol, because that affects everything. It's a neurotoxin. It affects blood pressure. It affects sleep. It affects.
So if you do drugs, whether it's marijuana or fentanyl or whatever, drugs hurt you.
Absolutely.
Salt, alcohol, salt, sugar. What else?
Yeah, and cocaine. I saw heart attacks in 20-year-olds when I was an intern at Cornell at New York Hospital. That was the first time I saw heart attacks in 20-year-olds, because their blood pressure when they do cocaine goes up to 200, 250. I was like shocked to see that. Their heart rate's going 150 times a minute, and the heart can't take going that fast for so long. And you see young people getting heart attacks. And of course, managing chronic stress is very important. That's why having purpose, having a job, having faith, having community, going to your synagogue, your church, your mosque, and helping others, doing good for others.
That comes under the point of reducing stress, and the time where you go to a synagogue or a church or a mosque or whatever you go into, time to unwind. Isn't that correct?
Yeah, absolutely. And you interact with like-minded people, and a lot of times communities like churches like the one we're part of, we're always trying to do community outreach, help the community. What you do with PAL and the Police Athletic League to help young people, those things are very important. That actually contributes to your health and to the health of many other. So spreading the good always helps with everything. And keep listening to WABC for more health tips. And we have an entire chapter in our new book, The Death of Aging, on heart health and the importance of heart health to maintain a good, long life, so we can both celebrate our 100th birthday one day.
Thank you so much, Dr. Peter Michalos, and let's live long and prosper, and I'll meet you at 100.
Thank you, John, for always getting the truth out on the Cats Roundtable.